In this workout, I'm going to be taking you through an advanced back strengthening 10-minute exercise program. We're going to be doing 30 seconds of rest, 30 seconds of work, and you will need a couple of weights during the next 10 minutes. So I recommend maybe getting a slightly heavy one and a slightly lighter one for the exercises. I've got the exercises in front of me. I've got a timer down here, and yours should be in the corner of the screen so you can follow along. First exercise is going to be a squat plus rotation. So we're going to do a squat, and then we're going to rotate one side and then the other side with our weight. Off we go. So squat, rotate, rotate, and then back up. Squat down, weight out in front, round to the right, round to the left, and back up. I'm going to show you to the front. So we're going to squat down, rotate round to the right, rotate round to the left, back to the middle, back up. That's tough. Out to the side, both sides, and then back up. Stop there. Whew, that's tough. Right, next one. We're going to do the same thing in terms of rotation, but with a lunge. So you're going to lunge forwards on one side, rotate, rotate, and then back to the middle, and then we'll alternate between left and right. So get your breath back, get your weight in your hand, get ready for the next exercise. We're going in 5, 4, 3, 2, 1, off we go. So we're going to lunge, weight out in front, round to the right, round to the left, back to the middle. So this is going to challenge your balance, and a little bit of, terrible, coordination as well. And then back to the middle. Lunge, rotate, rotate, and then back to the middle. Squeezing that tummy, squeezing that bottom, make everything nice and stable, and then come back. And we're going to stop there. Okay. Next exercise is going to be a deadlift. So I'm going to use these two lighter ones. We're going to have a little bit of bend in the knee, a little bit of bend in the hips. You're going chest down to the floor, and then we're going to lift up. Okay, so get yourselves comfy, get your breath back. We've got 5-ish seconds left, and then we're going to go. So 3, 2, 1, bit of bend in the knee, chest down to the floor, and then you're going to drive up through the knees, drive up through the hips. Looking forwards, trying to keep a nice straight back in your lower back, and you should feel a bit of a pull in your hamstrings, in the back of the thigh, your glutes, and maybe your lower back as well. Okay, a few more repetitions. Well done. Last one. Drive through the knees, drive through the hips. Perfect. Okay, right. Same thing, but we're going to do one leg. So we'll decrease the load. You could even do this exercise without any weight at all. I'd recommend holding on to something, but you're going to have one leg, which is going to be the one working, one leg out behind. Just going to lean forwards, try and touch the floor, and come back. If you felt comfortable enough to grab onto some load to bring on more of a pull in the back of the leg, you can. Off we go. And we're going 30 seconds. So this is a strength exercise. They're all strength exercises, but you may think holding on is cheating. It's not. You have to be stable in order to load yourself sufficiently. And if you're off balance, you're not going to be able to load yourself as much. Oh, I've lost my trail of coordination. So straighten the knee, straighten the hip, and extend up. Last one, and then we'll swap over. I'm going to swap sides so you can see me. If you feel like you want to just do body weight, you probably still feel a pull in the back of the hamstring without any load at all. But we're working on a hamstring attached right into the sort of buttock area. So for nice strong hamstrings, it's going to help with your lower back as well. So when you're ready, 3, 2, 1, off we go. Brilliant. A little bit of bend. If you can, keep a straight knee. That's perfect. I've got quite tight hamstrings, so I find it's quite difficult to keep a straight knee. You want to try and keep your pelvis aligned as well, nice and straight as you go down. Try and avoid kind of tilting the pelvis like this, nice and straight. And that will also bring more of a pull in the hamstring. 5 seconds left. Well done. Oh, really pulling. Okay, 30 seconds. Woo. Okay, next one, we're gonna jump on the floor. We're gonna do a single leg bridge. So, we're gonna do this twice this exercise. We're gonna do it once on one side, and then we're going to do it once on the other side. So, bend the knees, keep the feet on the floor. My right leg is gonna be doing the work first. You're gonna push up, and then down. Up, and then down. Perfect, 2 seconds, off we go. Okay, driving through that right foot, really squeezing the bottom muscles and the core. Push. Slowly down. Push. Slowly down. If you do feel like 30 seconds on the one side was just a bit too difficult, you could alternate between left and right, and you could do it for a minute. 3, 2, 1, and swap. Alternating between left and right will just give you the other side a little bit of rest when the other side is working, if that made any sense at all. Okay, so this time I'm going to go for the left side. Thighs are going to stay in line with each other. 15 seconds left. Whew, puffed. Okay. Okay, so get ready, get comfy. We're going in 3, 2, 1. I'm going to push up, slowly down, and push up, slowly down. So nice and slow, nice and controlled movement whilst you're doing this exercise. Similarly, if you found it quite easy, you could pop a weight across your tummy and just have a weight across your tummy whilst you were doing the exercise. Last few seconds. Perfect. Okay, great work. Next exercise, we're going to be in standing again. Now, if you have had an episode of back pain, or you're getting over an episode of back pain, or you're trying to prevent back pain coming back, bending and lifting can be something that people are quite worried and fearful about. So we are purposely going to include it in today's program, and we're literally just going to bend over, lift up. Off we go. Bend down and lift up. There is lots of absolute nonsense online and on social media and on other YouTube videos telling us to avoid bending if we've got back pain. That's a terrible idea unless you're in the very, very, very acute stages, because the longer we avoid something, the more sensitive the tissue gets and the harder it will become. That old adage of if you don't use it, you lose it is very relevant. Perfect. And stop there. Okay, right, last couple. We're going to do some diagonal lifts. So we're going to have one weight on the opposite leg. We're going to lift the weight up with this opposite arm, so right arm and left foot. We're going to lift the weight up. We're going to do it right across our bodies, push up, and then back down. We're going to push up and then back down. And we're going in 2, 1, go for it. Right, so push up and then back down. This is similar to the one we've just done, but with a little bit of a twist involved. Now, you may think, I've been told not to do this stuff, but the idea of exercise, particularly if you're rehabilitating something, is the exercise you're doing is supposed to make day-to-day life easier. Okay, so if you're doing stuff that's too easy, or you're doing stuff that's not specific to the function that you're trying to get back to, stop there, then day-to-day stuff's going to continue to be a challenge. So what we want to do is put a program together for you that is going to replicate, mimic the movements that you need to get better at day-to-day, like lifting your kids up, like carrying bags of shopping, like putting stuff in the top shelf at home that actually weighs something. Okay, last exercise. 5, 4, 3, 2, 1, opposite side, off we go. Last 30 seconds, work nice and hard on the last one. You've done really, really well. Oh, if you feel like we're having loads of fun and this has gone really quickly and you still got some energy left, you could just tap the replay button when we get to the end of this rep and you could do the whole workout. Again, you could do this for 20 minutes or 30 minutes, so you're getting 3 sets in, that'd be great. 5, 4, 3, 2, 1 for luck. Okay, brilliant work, guys. Well done. That was a 10-minute workout, advanced workout to try and strengthen up your back. If you are doing this program because you have had some back pain, you're trying to avoid back pain in the future, I have recently put together a completely free ebook, all based on the current evidence and guidelines on how to manage a new episode of low back pain. You can find a link to that in the description below the video. And if you have enjoyed the video, please do show your appreciation by liking it. And if you haven't already, do subscribe to the channel. It means you'll get notified every time I release new self-help videos and new workouts. And whilst you're doing that, I'll see you in the next one.